We welcome you to the second installment of the 2023 Expanding Research Partnerships webinar series. The series theme is leveraging collaboration to address key challenges to occupational safety and health research, training, and practice. Today's webinar will focus on new approaches to OSH training. Now, it is my pleasure to introduce Dr. Sarah Felkner, NIOSH's Associate Director for Research Integration. Sarah?
Thank you, Nicole. On behalf of NIOSH, I'd like to welcome everyone to our June installment of the Expanding Research Partnerships webinar. Today, we're pleased to bring together partners from occupational health and safety communities to learn about training innovations in an expanded OSH research paradigm. It's my pleasure to introduce our distinguished speakers. I'll briefly introduce them now so we can move quickly between presentations. Their full bios are available on the NIOSH Expanding Research Partnerships webpage. Our first speaker today is Lily Monsey. Lily is a research coordinator in the Department of Environmental and Occupational Health Sciences at the University of Washington in Seattle. She manages the Mentoring Smart Women Mentorship Program, a national pilot study seeking to improve social support and well-being for women working in the sheet metal trade, affiliated with the International Association of Sheet Metal, Air, Rail, and Transportation Workers, or SMART. She's conducted research with a variety of worker populations, including loggers and app-based drivers, and is passionate about using qualitative and mixed methods to characterize the experiences of underrepresented worker populations. Our second presentation today will include two speakers, Dr. Brett Perkison and Dr. Ismail Nabil. Brett is an assistant professor of environmental health sciences at the University of Texas School of Public Health and program director of the school's Occupational and Environmental Medicine residency program. Brett has extensive experience with disaster response training and responding to national flood disasters, including Hurricanes Katrina, Ike, and Harvey. Ismail is associate professor at the Icahn School of Medicine at Mount Sinai, specializing in three domains: internal medicine, occupational environmental medicine, and clinical bioinformatics. His focus has been on cutting-edge, innovative perspectives and solutions to enhance the health and well-being of worker populations in diverse and challenging environments. Our final speaker today will be Dr. Caitlin Gallagher. Caitlin is an associate professor of exercise science at the University of Arkansas, where she teaches undergraduate and graduate courses in biomechanics, workplace health, and research methods. Caitlin's research interests include biomechanics, musculoskeletal injuries, and workplace wellness, which she teaches through a systems lens that considers how organizational factors influence worker health. And now we're ready to begin our webinar. After the presentations from our speakers has concluded, we will have a Q&A session with the audience. Please put your questions in the Q&A box at any time during the webinar. And now, without further delay, I'd like to invite Lily Monsey to our virtual podium. Lily?
Thank you so much for the introduction, Sarah, and such a pleasure to be here. Thank you to all of my co-presenters today. Looking forward to your presentations and looking forward to telling you more about the Mentoring Smart Women project, which, like Sarah mentioned, is a coordinated mentorship program seeking to support the safety, health, and well-being of female sheet metal workers affiliated with SMART International. Before I get into the agenda and what I'll be telling you a little bit more about today, I want to acknowledge the principal investigator for this study, Dr. Marissa Baker, also here at the University of Washington, who leads this research and with whom I've collaborated on this project for the last 3 years. So to give you a sense of what we will review today pertaining to this project, first, I'd like to give you all a study overview as well as some background pilot research that helped us build out the concept for this particular grant. I will go into more detail, especially about our development of the curriculum for the mentorship training itself. I'll also discuss some study progress, where we are now in our grant cycle, as well as some preliminary results, especially from our mentors who have gone through a couple rounds of mentorship training. And lastly, I will discuss some challenges around retention, upcoming study activity for the remainder of our grant period, and potential directions for future research and dissemination of our mentorship training program. So to give you a sense of the pilot research and study background that fueled this current mentorship program, pilot research conducted here in Washington State showed us that tradeswomen are at much higher risk for a variety of both psychosocial and physical risk factors on the job than their male counterparts. I'm going to get into more detail about what exactly those are in a couple of slides. But first, I want to share with you some of the results from focus groups that were conducted with women here in Washington State from a variety of different construction trades, all of whom let us know and told us that they saw mentorship as a really effective strategy and potential way to mitigate some of the gendered hazards that they face on the job. A lot of them cited that just having someone to talk to and having someone who understands what being a woman in the trade looks like and means can mean a lot, especially when you're the only woman on a job site, particularly if you might be one of very few women in your local and simply don't get a lot of opportunities to seek support and help with what you might be going through. This grant is also conducted in partnership with Smart International. Without their support, we really would not be able to do this. They have allowed us to partner with their local unions all over the country and really helped us in identifying coordinators on the ground at each of those locals who have made it possible for us to recruit our amazing mentors and mentees. This research is also funded by CPWR, which is the Center for Construction Research and Training. And this whole grant and this mentorship project as a whole is part of NAB2's efforts to improve working conditions for female construction workers in the industry. Before I get into some of those hazards I discussed on the last slide, I want to take a moment to acknowledge the benefits of being in the construction industry for tradeswomen and some of the things that really motivate the women that we talk to for getting into the trade in the first place. I think a lot of times when we want to help solve occupational safety and health issues, we focus lots on the challenges and some of the potential negatives. And I want to take a minute to acknowledge the reasons that women want to get into this trade, want to help incoming women come into and stay in this trade, and why it is really a meaningful career path to them. So first off, the trades offer high wages and good benefits. You are able to earn while you learn. So as you go through apprenticeship, you are paid, and it is a way to learn a new trade without accruing debt. A lot of the tradeswomen who we work with also cite that self-confidence rises when they enter the trades. They are able to develop a variety of transferable skills, feel a lot of pride in their work, and feel like the work they do is challenging and rewarding. One woman from our pilot study said, as we go about completing our projects, we all said, I've done that, I can do this. And if you find that you can do all these amazing things on a job site, it helps you build your character even outside of your job. So getting into more of the gendered risk factors and reasons that we really wanted to build and disseminate this mentorship program, specifically tradeswomen are at higher risk for a variety of psychosocial risk factors. Those include discrimination, harassment, increased challenges around work-life balance with balancing family obligations that they might have more responsibilities around than their male counterparts. Physical risk factors are also heightened for tradeswomen. They are at increased injury risk, they face increased workload demands, and they also feel pressure to overcompensate on the job, which can in turn lead to increased injury risk. Not noted here, but I do want to draw attention to the fact that ill-fitting PPE is also a major concern among tradeswomen. Having harnesses and gloves that fit well, among other PPE, is really important and something that isn't always accessible to tradeswomen on the job and can present a real safety hazard. So our mentorship program, while mentorship does have a long history in the trades, it's often focused more on technical skill development. What we wanted to do with this mentorship program was to help tradeswomen build a variety of leadership skills and social support skills that they could take and apply to a variety of different settings, both on and off the job site. So specifically, the toolbox of skills that we focused on in our training were active listening, goal setting, problem solving, and self-advocacy. Our goal with imparting these to our tradeswomen mentors was to offer avenues to empowerment and increased leadership skills, and hopefully for those to also transfer to their mentees as they work with them throughout the year. To get into the study design, this is a randomized control trial. We began with 18 locals from around the country affiliated with SMART International. All of these locals have at least 5 women apprentices. The goal here was just to make sure that there were enough women at any participating local to help sustain a mentorship project. So I do want to acknowledge that this study does include locals already who have at least a few women. And in doing so, we aren't necessarily reaching at this point locals with very, very few women, fewer than 5, which is something we would like to do in the future. Among those 18 SMART locals, 10 were on our intervention arm and received the mentorship training project now, and 8 were our control locals. So we, among our intervention locals, recruited and trained our mentors, matched them with apprentice mentees, and then follow them through year-long relationships. We repeated this process 2 times. So instead of having one round of 2-year mentoring relationships, we actually had 2 rounds of 1-year mentoring relationships. Our goal here was to recruit and train another cohort of mentors after the first year of mentorship, so we could add them to our current cohort and hopefully boost our numbers. We also wanted to reach more apprentice mentees and recruit new mentees so that we could hopefully reach more folks with the program. On the control side, we recruited women apprentices and have followed them from baseline to mid-year to end of year. We've recruited another round to follow the 2-year and 2-round model on our intervention side. And our goal at the conclusion of the study, which will be coming up in about a year, is to disseminate the mentorship program more widely, not only to SMART locals around the country, but also to other trades. And I'll get into that later about some of our ideas and hopes for dissemination. Some anticipated outcomes we have from this project, both short and intermediate term outcomes are ones that we are measuring when we evaluate from both mentors and mentees at beginning, mid, and end of year surveys. So some of these include increased awareness of safety and health risks, increased self-efficacy, increased awareness of self-advocacy and problem-solving strategies, and improved social support at work. On the intermediate side, we are hoping to see a reduction in perceived stress, increased self-advocacy and problem-solving behavior and skills, an increase in job satisfaction, and hopefully also an increase in retention in apprenticeship in the trade. Some end goals, things that we don't anticipate seeing in this grant cycle, but we hope with sustained mentorship activity we might see in the longer term, is reduced injuries, improved job site safety climate, and increased representation of women in the trade overall. So I'll be getting into more of our development of the mentorship training curriculum. And briefly, I want to make a note that it changed significantly from what we had proposed to what we actually delivered given the constraints of COVID-19. Some of the changes we made were to pivot to an all online training delivery. We had originally planned to train mentors in person and fly them out to a common destination. That was not possible. And so we did all of our training through online asynchronous modules that we developed, as well as Zoom-based synchronous sessions. So not only did we develop an all-online program, but we also reduced the overall training length, particularly for tradeswomen who are already pretty strapped and busy and have lots on their plates. We could see that the added stress of the pandemic was also reducing capacity even more. So it felt important to us to really streamline the content of what we offered in the training and make sure that we were really only asking for the essential time that we needed from our mentors to help boost participation and hopefully make more mentors feel like they would be able to participate in the program. We also designed the curriculum specifically for remote communication strategies, since we knew that a lot of our mentors and mentees would be meeting and maintaining relationships remotely. So this gives you a much more in-depth look at our actual mentorship training curriculum. The purple, blue, green, and yellow boxes all represent sections of our online asynchronous self-paced curriculum. And the orange boxes at the bottom represent the timing and staggering of our synchronous training sessions that we conducted via Zoom. So our goal, in lieu of having any in-person any in-person element to our mentorship training was to hopefully foster some in-person discussion and contextualization of the skills that we were presenting in the online self-paced training in those Zoom sessions. And specifically, our mentor toolbox included content on relationship building, goal practices, and active listening. And we also have a mentee toolbox, which was designed more for mentors to develop skills that they would impart on their mentees, problem solving and self-advocacy. And again, our goal with this was to really provide mentors with chunks of meaningful content that they could work through in 15 to 25-minute portions, and then to contextualize and practice those skills together via Zoom in those synchronous sessions. These are some stills from our asynchronous mentor training, which included video portions, text, audio, and visual diagrams and click-through scenarios. As I mentioned, these were 15 to 25-minute sections. We wanted folks to be able to sit down and complete a brief section in between activities in a busy day, because we knew that was kind of the needs of the population we were working with here. And I also want to acknowledge Lisa Davis, who is the person pictured on the left-hand side of that left-hand still. She, along with Vanessa Carmen out here at Local 66, was instrumental in helping us develop really authentic scenarios to add to our training and to make sure that the content we were presenting in our training was applicable and authentic for a tradeswoman audience. Getting into some of the initial evaluation of the program, this was our initial mentor training evaluation and includes both feedback from rounds 1 and rounds 2 of our mentor training. Overall, our mentors agreed or strongly agreed that after receiving the training, their confidence increased as a mentor. They also felt like overall, the training series was effective in advancing understanding of the components of mentoring relationships. Getting a bit more into specifics here, I want to highlight that a majority of our mentors felt like the training increased and changed confidence in skills around goal setting and supporting mentee growth, as well as understanding how to use a combination of mentoring skills. Again, really our goal here was to help mentors contextualize applicable, wide-ranging skills and impart them on their mentees, things that weren't necessarily technically based, but that could be applied to a variety of scenarios on the job site or within their work or apprenticeship programs. Some mentor feedback we received, particularly after this last round of mentorship training, one of which here on the left-hand side pertains to the online asynchronous curriculum and was specific to the active listening portion of that training. This particular mentor felt like the active listening exercise was helpful and an easy way to focus on what is said versus what isn't. Something that we heard from one of our mentors after our Zoom synchronous sessions was that it would be helpful to learn more about how to overcome the "I don't need a mentor right now" issue, which is something that we have been trying to address directly by communicating more directly with our mentees and reminding them that, even if there is not a particular issue you have right now, you can still discuss goals you might have with your mentor. Continuing to build that relationship, even when there isn't a particular problem, is still a meaningful and worthwhile practice. So that's something we're working more directly with our mentees on in this round. One thing I'll also note here is that both our mentors and mentees report that having a mentor is really useful for also accessing resources via your local union. We've talked to a lot of mentees who are like, I just didn't know that this particular resource existed until I had a mentor and until I had someone who reminded me, here's how you can access this. So one thing we're finding is that mentorship not only offers skills in and of itself to both our mentors and mentees, but helps our mentors and mentees access resources that already exist. Current activity we have going on right now, we are in round 2 of our mentorship training, and we have matched mentors and mentees. We are currently in the process of conducting qualitative interviews with former mentors, mentees, and project coordinators at our local. We're hoping to conduct at least 15 of these by the end of the study period. We're also creating some specific skill-based videos to add to our asynchronous online training. And our hope here is that this gives a more in-person and authentic flavor to our online training once we disseminate the program more widely at the conclusion of the grant period. We're also looking at Bureau of Labor Statistics retention data to understand across trades where, why, and what reasons there might be for women leaving the trade. I also want to point out a few retention challenges that we have right now. We have struggled with mentees deciding to drop out of the program, citing lack of capacity, that they dropped out of the apprenticeship or union or changed career paths. Controls also left the apprenticeship or union, and that was the primary reason for folks dropping out. While we hope that this mentorship program ultimately provides a framework to help women feel supported and want to stay in the trade, we're also seeing that this very issue, that is retention, is also cropping up and presenting some challenges for us in the midst of this project. A few highlights from our qualitative interviews. I'll read one here on the right-hand side, but one of our project coordinators told us, "I do this work because I want others to have the opportunities I have. This is empowering, and I want to see people succeed." This really echoes the sentiment we hear from our mentors as to why they want to do this program and put in the time and effort to mentor their mentees. So I just wanted to highlight some of the sentiments we've heard, not only from project coordinators, but also from mentors so far in those qualitative interviews. Looking ahead, we are also wanting to, as we sort of come out of the restrictions of COVID-19, integrate some in-person touchstones for mentorship, including skill up trainings, integrating mentorship into in-person women's committee meetings. And that's something we're looking at as we aim to disseminate this program more widely. We also want to have a resource for mentors and mentees at the local level who can help participants facing any challenges beyond the scope of this grant. That is something we have now, but want to make sure is in place for any locals who want to continue this mentorship program beyond this actual grant period. And like I mentioned, we're really discussing as a team and with our advisory board, the dissemination of this mentorship program to other smart locals and other trades and ways that we can most effectively do that. So with that, I want to acknowledge CPWR, our funder, Smart International, our advisory board, our study team members, our trainer, M. Miller, who facilitated our Zoom synchronous sessions, as well as Lisa Davis, our Smart Mentor Extraordinaire, who has served as a resource to all of our mentors throughout this project. Thank you so much.
Thank you, Lily, for that great presentation on the innovative partnerships you've developed in this unique mentorship training program. And now we'd like to welcome Dr. Brett Ferguson and Dr. Ismail Nabil to our virtual podium.
Great. Thank you for the introduction, Dr. Felkner, and really glad to have the opportunity to chat with you all here. We're going to talk about our electronic learning platform developed for workers that are involved in rescue and recovery operations in diverse flooding environments, which we have named Pocket Arc. And in the presentation today, we're going to give you a little bit of an overview about the development of Pocket Arc, initial development, and currently where we're at in the product, as well as a small short demonstration of our goals here. The funding for this was through an SBIR grant, a phase 1 and 2 grant from the National Institute of Environmental Health Sciences. So, like Dr. Muncy, we have focused on construction workers for this application. And one of the reasons why is construction work is still by major industry one of the one of the highest fatality rates of any industry, and really an area that needs for further development to improve health and safety in. When we combine this with the fact that natural disasters are increasing throughout the country, in 2020 there were 22 separate over $1 billion disasters alone in that 1 year. And I think we're all familiar with the types of disasters. In the West, it's drought and wildfires. Along the Gulf Coast and East Coast, hurricanes, and in the Mid-South, extensive tornado damage and flooding. that there is a great need for development of not only construction workers, but what really has come to be termed reconstruction workers, a group of workers that go into these areas that have been affected by natural disasters. They're a highly mobile group. They're often operating with limited power and supplies, including personal protective equipment, and there's limited communication. Often in the weeks and early months after an event, it's a very chaotic situation. My own personal experience with this was literally came to my front door, has been involved in natural disasters, particularly hurricanes in the Houston area. As Dr. Felkner had mentioned previously, I'd been involved in disaster response activities throughout my career along the Gulf Coast. But the latest experience and most extensive was 2017, when Hurricane Harvey damaged over 200,000 residences in the Houston, Harris County area. And this map here indicates that refers to areas that were flooded in Houston, with each gradation of darker blue indicating a higher level of flooding up to over 10 feet. And our group, our department at the University of Texas School of Public Health, had a supply of N95 masks and gloves, and we assembled over 3,000 kits and handed these out to communities of workers and residences with instructions in English and Spanish on how to safely clean flooded homes and properly put on an N95 mask. And in the meantime, we also asked recipients if they had questions, and that if we could contact them in 6 months to ask them how they were doing after the storm. From that experience, we learned a number of things from this study and other studies, which I can put the citation in the chat box, but we really learned that there are a number of health risks that workers encounter, both respiratory from respiratory irritants from cleaning out sheetrock, and allergenic irritants from the mold that they encounter in these hot, moist, warm environments, waterborne exposures from water treatment plants that aren't working properly after the flood, to very basic things like lack of food, water, lodging when they come into these areas, and lack of access to healthcare when they're doing these dangerous jobs. Also unsafe working conditions. Oftentimes these are workers that have had no previous experience with construction work or health and safety information. They have lack of supplies, which I mentioned, and lack of communication. But there's also issues that are common to construction workers, which are even amplified in the post-flood environment, such as exploitation risks, wage theft, and their own personal security risks. There are not any law enforcement or other security forces out there in these areas where they're working. As we develop this and learn more about this group of people that we've reached out to help, we've also partnered with a group known as Resilience Force, which is based out of New Orleans and really had their inception after Hurricane Katrina. And this group is a very, very dynamic juggernaut. We actually have one of our the founders of Resilience Force's worker advocacy group on the line, hopefully, Cynthia Hernandez, which we've been partnering with closely. And if you have time and are interested, I would encourage you to read this article from the New Yorker from 2021, which really profiles some individual cases of what people encounter when they're going into this work environment, and really how extensive this subset of workers has developed right under our noses, that there are now thousands and thousands of workers that are out there doing this job from every natural disaster that we encounter. And Resilience Force, we have really kind of developed this app with hand in hand. Most of their staff were construction workers themselves, really understand what it's like to be out there in the field. They pass out supplies, first aid kits. They also provide worker health and safety information, and they go to areas both along the Gulf Coast that are affected by hurricanes, in the Mid-South and in the West now with wildfires, and provide training sessions to these workers in advance. From this, we've developed Pocket Art, which is really, you can think of it in terms of three different parts of its application, all within one software development. And so pre-deployment, we're really focusing on training augmentation, training the workforce on basic health and safety needs that they will encounter out there in a particular flooded or post-wildfire environment. From this, we're establishing a dashboard, which is a readiness assessment, which really establishes their readiness to go out into that environment, as well as the health assessment, which is what are their medical needs that they need to be aware of when they're going into this environment. In the deployment setting, when they're actually out there in the field, we want to primarily help work with the advocacy workers such as Resilience Force or with in the private industry with contractors to help these workers find lodging and find food, find supplies. That's really what's now is being done informally, is developed on applications such as WhatsApp, but we want to formalize that through a sort of a one and all training and logistical information in one application. And then post-deployment, we want to continue that training and help with specialty certification that's needed, as well as continuing health assessments for trying to pick up on different health issues that might have risen from their exposure in the storm environment. Not only that, but we're really working on two interfaces. We're really working on the interface for the worker advocacy person who's trying to find these resources for the workers, and then from the worker themselves to assess that. And so that will be part of this that will be applicable to worker advocacy groups, private contractors, for government groups, agencies such as FEMA that might go out in the field and have need for this. I have a short video that sort of gives this an overview on this that I'm going to play right now and give you a little bit better idea of sort of the dynamic state of what this involves.
Pocket Arc, in its development stage, addresses an unmet need for laborers, advocacy groups, and coordinating organizations involved in post-disaster recovery work. The app is intended to help keep workers safe and healthy before, during, and after deployment. The program's key features include a collection of fun, engaging safety training modules, a job planning feature focused on safety and security, and a crowdsourced resource locator for use in the field. Coordinators can also connect and communicate with workers to help them along the way. When a worker launches the app, they can quickly see a summary of status and tools. They can see status on any training in progress, any in-progress job plans, and news about available resources such as food, medical care, or safety equipment in the area when they're on deployment. The experience starts with a baseline health assessment that delivers tailored recommendations for on-the-job health management. For example, if a worker reports they're on daily medication, each job plan will contain a recommendation to take meds when going on deployment. The training program is organized into brief, easy-to-consume modules, each accompanied by an engaging story and a quick interactive activity to test the worker's knowledge. These modules cover common topics such as selecting safety equipment, fitting equipment properly, and how to make good decisions regarding fallback options if standard equipment is not available at a given site. When preparing for a new deployment, workers can make a job plan that includes information about where they're going, who hired them, and what they're being paid. Coordinators can also link job plans to specific safety training modules based on the environmental conditions in the deployment area. Once the plan is completed, the worker can text it to their employer for confirmation. It'll also be sent to the coordinator in case a worker needs additional support. Finally, when a worker signs up with Pocket Arc, they are given a unique ID code to help protect their identity when working jobs. During deployment, resource location becomes critical. Workers often need things like a place to sleep, water, first aid, clothes, and other basics. With Pocket Arc's crowdsourced resource locator, workers can find and map resources nearby. Pocket Arc also features a coordinator toolset that supports the unique needs of worker advocacy and coordinating organizations. With these tools, coordinators can communicate with cohorts of workers to help ensure that workers have appropriate training and access to resources in the field. These tools leverage common apps like WhatsApp, which are already widely used in the field. Pocket Arc bridges current gaps in safety information. Training. coordination, and communication, providing a powerful set of tools while also protecting worker identity.
Thanks, Fred. Thanks for setting up the scenarios for me. Just to give you an outline, this app is under development for past five years almost, and we have a lot of input from different stakeholders as well. And so every single step that we are taking is deliberate, and we go and work with the individuals in the field and figure out what's the right focus needs to be. And it continues to evolve as we see the need of the community in the environments that they're working. Some of the programming challenges that we always had, I was always impressed by the technology that these construction workers use in the field. I had a chance to meet some of them, and I was surprised to hear that they are using some of the recent touch phones. And so it's important to have the platform, both the Android and iOS development needs to be there, and that's what we're using for app development at the front end. In the back end, it's a majority of case we do use JavaScript or no JavaScript or MariaDB, which is commonly used as a backend for mobile development. And operationally, we also have thought about what the communication channels will be open if, in terms of disaster. The app works fully functionally during the 4G or 5G coverage of the zone, but we're also thinking about minimal sort of communications if there is a lack of connectivity, or the network is only operational at a 2G level or 3G level. So there's definitely a need that we can fulfill for these communities at work. The initial app was, we did the feasibility study early on, where 12 construction workers were enlisted. All of them speak Spanish, and that's what we have seen in these working communities, that they are predominantly a Spanish speaker. And their knowledge base is different or differ from each other significantly, and it's important to help them understand what the safety issues are at the workplace. So we did the knowledge test with them, and as well as the practical exam to see if there is some retention of the subject matter when they have been given the application. So 5 were able to complete the written exam or practicum testing as well. 4 required assistance. Again, just to give you a picture of these workers, they come from all backgrounds, from different dialects, different learning abilities. So we need to be cognizant of that and help. But overall, we did see the knowledge score increases. Again, this is a very small cohort of workers, but this is, again, a feasibility testing was done, and there was some mean score increase that these individuals were able to do. And the focus has been now to create the content that is much more widely used by individuals with different learning abilities, and that's what we are focused on. And pictures are 1,000 words sometimes. There's a project roadmap. So as I mentioned, that we've been working with this funded by NIEHS. Phase 1 is complete. We are in the midst of phase 2, working through full system development and scaled evaluation that's coming this year, and hopefully move to commercialization potential of the application in hopefully next year and end it by 2024. We always look for partners that can help us enhance this application further. And we definitely think that there's a significant use of this application across the industry. There are always informants, commercialization partners who always help us in terms of giving us direction of how to move forward with the app development. There are multiple stakeholders that we have identified that can help us in this development, not only workers, but community organizers, advocacy organizations, public health agencies, government agencies, construction industry, and other disaster preparedness relief organizations that are working with communities at the time. The app could be modified or enhanced in a way that allows us to work with all potential stakeholders for the app. With that, I want to thank you for the time. I appreciate all questions. Thanks.
Thank you, Brett and Ismail, for your presentation on these innovative approaches to using e-learning platforms to help prepare disaster response workers who often encounter such dangerous and difficult work environment conditions. Our last speaker today will be Dr. Caitlin Gallagher. Caitlin, welcome to the virtual podium.
Thank you very much, Sarah. So thank you for having me, as well as the Office of Research Integration. I'm going to talk about something a little bit different. So my talk is on taking action, adding workplace health to the university curriculum. First, in today's talk, I'm going to just talk about my positionality, my journey, being in an exercise science department. How did I get here to be talking to you today? We'll talk about the motivation, both theoretical and practical, for incorporating workplace health training into the university curriculum. I'll give my example of how I did this. We'll talk about some potential roadblocks for higher education in the US and talk about future program stability or sustainability. So my background, when I was 17, I loved basketball, I played soccer, I love sports. So that was kind of my main driver in things that I chose in high school, things that I really liked. But I became a statistic when I was 17. I tore my ACL playing basketball. I never really got back into it again, but what I learned was that there was this career called physical therapy that I could go into. I was volunteering there, and it influenced what my decision was to go to school. And so I am from Canada. I went to the University of Waterloo in Canada, which is about an hour outside of Toronto. And so I majored in kinesiology. This was the initial undergraduate program that I would go to. The University of Waterloo is known worldwide for its co-op education program. So here, most of the programs that they have there, every 4 months after your first year, you're going to go work full time, and then you come back and you go to school. So I did that. The curriculum has 3 main streams. In your first 2 years, you take things in all of these different streams, plus all of some of the general education that you would see. So there's 3 are biomechanics, physiology, and neuroscience. The biomechanics is very much rooted in occupational biomechanics. So I had a lot of training when I went down this road, in that they did have an ergonomics option for focus where you could take some systems engineering courses as well. I didn't end up pursuing that. That was just kind of the timing that it went through. So when we look at what my experience was working, remember every 4 months I was going out to work full time. So I wanted to be a physical therapist. So the first thing that I went was I was a physical therapist assistant. I learned really quickly in that job that I didn't want to be a physical therapist at all, but there was a lot of valuable things that I learned in this job. One was that one of the therapists only treated people who had had workplace injuries. So I saw a lot of workplace injuries come through. The one that I remember most was a group of mostly women who had all had carpal tunnel surgery and were going through their rehab, and they worked at I believe it was a makeup factory, and they worked based on piecework. So based on the number of lipstick containers that they could put together, and they were relatively young, and here they were having to come into rehab for it. And so I wrote my first co-op report on wrist bracing with carpal tunnel from there. because we had so much training in occupational biomechanics and ergonomics, there were a lot of companies that were looking for student ergonomists. So I started going down that route. They paid a lot better as well at that age. And so I ended up working at Volvo Motor Graders near us. And so I was a student ergonomist. I did a lot of physical demands descriptions. I worked a lot just being in Canada at the time. So when the Ministry of Labor would come through, if there was anything that needed to be done, I learned about heat stress. Even in the summers in Ontario, those buildings can get really hot. So learned a lot about that from there. So I got a lot of experience. But when I was at school, I really thought that I wanted to be in research. And so my next 3 jobs that I worked in were in occupational biomechanics labs. One to do with spinal disorders in the low back, which is the one I ended up staying in. And another one had to do with walking. And so we looked at like drywall stilts and things like that. And I was hooked, got my PhD, and now I am down here still teaching in kind of the kinesiology area. But what I wanted to tell that story for is my experience came from looking at how do we get people interested in occupational health. So there's this concept of situational interest and situational curiosity, and I learned about it from James Lang, who talks a lot about how we teach, and in his book Distracted in 2020 that talks a lot about attention, he reviewed a theoretical model by these cognitive scientists that discussed how we learn. He said there's 2 ways that they talk about interest in their model, but he talked about it as curiosity. And so my initial curiosity of getting into kinesiology had to do with my situations of sports. I'm going to pursue kines from there. And so this would be similar to students who are getting their degree already in an occupational health and safety field. They're taking occupational health and safety classes. They're already really interested in that. But once I got to university, that was an example of situational curiosity. So even though I was really interested in sports coming in, I gained an interest in workplace health due to my education and my work experiences. So this would be your students that are outside of traditional occupational health and safety fields. And you never know that students may be surprised by their interest in a new field. And as teachers, what James Lang talks about is we're responsible a lot for situational curiosity. We don't have much control over their individual curiosity coming in, but we do have control of helping them become interested in the field based off of and getting them interested in things there. That they may not have been interested before. There are some problems with that, or just some implementation issues. The first is curriculum burden. And so when we look at occupational safety and health training, so initial commentary, is that when we look at the skills that occupational safety and health has been through, it's built through occupational medicine, nursing, industrial hygiene, epidemiology, toxicology, engineering, occupational psych, and law. But to really implement these things in a systems-based world, people need a lot more skills than that. And they go on to list a variety of different things that people should have skills in. It's not that they should all learn them in their undergraduate curriculum, but if you're a occupational safety and health trainee, one of the first things may be like, how am I supposed to learn all of this? Or if you're designing curriculum, how am I supposed to be an expert and all this? And then it's really challenging to get these into curriculums. And this is not the only field. We see that, say, in medical school, where physicians and trainees are really wanting that there's new content that needs to be put in, but where do we fit it in and how? And this can potentially lead to overcrowding in a curriculum, especially if you start adding specific classes on. They're looking at this, and this editorial from the Canadian Medical Education Journal really says that we keep adding more content based on these new areas of interest, but little has been removed, and this can create whether it's a cognitive burden in terms of what people need to study, but it also can create a debt burden if we keep adding credit hours on for what people need to be learning. So those are things that we need to put in. Again, it's easier said than done, really, changing a curriculum and going through. But when we look at the calls for how do we train people and effectively bring in occupational safety and health training, this is from a report from the International Labor Organization that talks about one thing we need to do is build confidence in occupational safety and health, right? So we need to bring it into general education and continuing education through work lives. And so we want to bring that in and we want to promote it. But we also see that managing occupational safety and health is a multidisciplinary manner, and people need to have a lot of different backgrounds in it. And there needs to be people from a lot of different things. Reinforcing the role in government, so they need to understand, what are the ways and how do we partner with them? So really collaborative calls to bring in to influence training. I'll bring in an example, though, of where we run into some issues as well with this collaborative model of, we need all of these different areas in. Excuse me. So this was a paper from the International Ergonomics Association, really brought together for strategies of human factors and ergonomics professionals and how we develop the discipline. And so they talk about how human factors and ergonomics has a two-pronged value proposition: well-being and performance, if we look at those at a very high level. And so the well-being one is the one that has mostly been concentrated on, whether it's through research, whether it's through talking, is that human factors and ergonomics can reduce the risk of injury and can help with employer well-being. Well, the people who are really interested in this prong of the value proposition are system actors and influencers. So system actors may be the employees themselves, so say your frontline workers, and influencers could be the government entities, they could be different societies that are really interested in influencing this. But a lot of the times, especially with the system actors, is these are dependent stakeholders. They are dependent, they have little influence in system design, but strong interest in the outcomes. And so this is the enhancing the well-being is a strong value proposition for these stakeholders. On the other hand, we have a group of individuals that we would describe as the dominant stakeholders who are responsible for influencing system design. So whether it's the actual design of it or whether it's the financial incentives that provide the money to influence the design. So even if they're interested in well-being, there is a part of them that have a vested interest in the performance and value proposition of human factors and ergonomics. And they are more powerful in this design process, but they may generally be unaware that HFE can provide any value to them. So being able to discuss both the well-being and the performance value propositions together is going to be really important. As I look at my training growing up, whether through the undergraduate curriculum or my graduate curriculum, we talked a lot about well-being, but we did not always have performance indicators in our study. And so I would, talk about all these benefits to my research, and someone would be like, well, why would I put that in, or how much does that cost? And I didn't really have answers to it in my training. So that is an area of improvement, even in the health-based disciplines, is that we have to talk about a lot of these different things, but also then training those dominant stakeholders and giving them education of how there are balances to these two different things. Oops. But in terms of the practical motivation, we've talked about COVID a few times in this talk. The practical motivation for me creating a course like this was COVID-19. And while there are a lot of workplace issues that came around with COVID-19, for sure, in terms of spread, I had nothing to teach in one of my semesters because I teach a lab-based biomechanics course in the spring or winter semester. And we weren't doing any in-person things. And so I had an opening in my teaching schedule and I was like, what am I going to teach? And this was a course, General Health in the Workplace was a course that I had wanted to teach for a long time. And so I was like, that's what we're going to do. Students need classes just because of what we can't offer typically. So that was my practical motivation for bringing this in. And so that led me to teach or propose a general course that I just called Health in the Workplace. It was a special topics course, which is a course in a university curriculum that meets the needs of whatever is coming through. It's usually meant for temporary or testing classes. And so it was a 3,000 level class, so typically like a junior level class, third year course there. I had a list of topics we may or may not we're going to talk about, why people should take the course. We had to pivot really quickly, so this didn't really get offered to people going through. And the reason I'm here today is because I presented this outcome of my very initial talk as part of the X4 OSH concert or X4 OSH conference in December 2021, the case study from this initial course that I'll talk about going through here. So when we talk about some of these different models of education, there's 3 different types of models maybe that we could talk about. There's multidisciplinary. So that's what we typically think about with maybe an intro to psych class where students work in parallel from different disciplinary or specific bases. We have interdisciplinary courses. So this is where students and faculty work together to address problems in their discipline. So they're really interacting a lot more, bringing in their knowledge. And then there's transdisciplinary, which goes one up on interdisciplinary courses through collaboration in creating the curriculum, but also collaboration in the students to really solve problems going forward. There's also interprofessional education, which could be very valuable when trying to teach this. So this is when 2 or more professions learn about, from, and with each other to enable effective collaboration and improve health outcomes. So this is something done in healthcare where the goal is to improve teamwork between disciplines, enhance quality of patient care, and improve health outcomes. And the reason I bring this up is because these are things that we may want to focus on. So I have a table from the paper listed below on interprofessional education, tips and design for implementation. And so we have discussing people's roles and responsibilities, their ethical practices, conflict resolution, communication, and collaboration and teamwork. So I'm not going to go deep into the curriculum that we taught, but what I ended up also doing is not only was it an exercise science class, it was also listed as a management class. So in spring or winter of 2021, it was completely virtual. It was partially synchronous and asynchronous. We had 2 management enrollees and 11 exercise science enrollees. In fall 2022, I offered this course again. So it was 100% in person. We had 10 management enrollees and 15 exercise science enrollees in that semester. The basis of the course was that it was systems-based and really emphasizing the socio-ecological model. We used the total worker health approaches and really just looking at what things do we want to talk about and what could be implemented, and talking about work as a social determinant of health from there. So these were kind of overarching things in all of our topics. For resources, there were no textbook or resource courses, so they paid their tuition, but there was nothing additional. There was a typical class in terms of the tests, but what I really implemented was cultivating situational curiosity, and how you do that is through reflections and relating the content to their own lives. And this can be as simple as having students reflect on their previous work experiences. What did they like? What did they not like? And then as you go through the course, having people kind of ping back to, what is your experience with this? How have you seen this? Have you experienced people in their lives experiencing it? So people talk a lot about how they've seen their parents work. And people could choose the job or topic of interest to them. So a lot of them thought about things that they had been in or what they wanted to do in the future. So we used a lot of videos and guest speakers because can only talk as an expert in so much. And then we read about current events in workplace health. So 3 examples would be like, this was when the railroad strike was potentially going to happen, and that sick days and days off for medical going to the doctor were things that were in contention. So we talked about, even separate from railroad workers, like how would you implement this in your life? How do you take care of your own health when you're at the job, and going to the doctor and things like that? They are, these are 19 to 23-year-olds. And so social media, and there's a lot of posts on workplace and workplace health. And so what social media posts were from there. And then I looked at some podcasts. So Arkansas PBS had a podcast on farmer mental health in the state. So we listened to that and talked about the agriculture, went from there. Here's just a list of topics that we make. I like to say that this is like a potpourri course. We really just want people to get an idea of what is out there. And some of the topics that people really cared about were social determinants of health, the built environment. So they talked a lot about their own allergies, or, you know, who pays for improvements, exertional heat illness, health professional well-being, because a lot of our students were actually currently working as either certified nursing assistants, or through COVID, you know, what are the things there? Really, the biggest one, though, was psychosocial risk factors and burnout, because as students who had just gone through kind of COVID, students who are managing work and school, they were extremely burnt out. And so really interested in those topics. And then the last one I think would be family and work. That is definitely in terms of what the US doesn't have, and then how it relates to other countries in the world. I used some NIOSH topics as well. So one of the things that I did for my first example was use the Healthy Work Participatory Program from CPH New, and we went through the ideas process. So just some initial part. We had baseline data on student health that we had taken through an exercises medicine, which is something from the American College of Sports Medicine. So students could look at ways to improve student mental health on campus or student diet. We also used the Center for Healthy Work at the University of Illinois Chicago's game called In a Year's Work. It's been advanced since when we used it, but playing online, and it was really interesting to have students go through and reflect at the different levels and how realistic it was or it wasn't, and talk about why they thought maybe things weren't realistic. And sometimes, you know, it was that those were actual scenarios people were dealing with. And some of the students really couldn't believe it going through. So bringing that in, going through there, we utilized some different guest speakers. So with exertional heat stroke, organizational climate and construction, corporate wellness, building design, return on investment, and looking at small businesses specifically. And then finally, I'll go through just kind of our evaluation and what really is the outcome. So it could be we want more people to go into occupational safety and health, but really my goal through these courses was to just get people thinking about it more. And for my exercise science student, they said, I thought this class was going to be about how to stay healthy as an individual and to be able to work better. I was not, looking back at this, it made me laugh because I was not expecting this class to be about what it was to be about. And as we near the end of this course, my perception of health in the workplace has completely changed. It's a team effort that has so many factors, and it's not just how an individual can keep themselves healthy, but how other things like safety standards, culture, climate, and mental health can play a role. And this was from a business student who initially said, you know, things for her thought at the beginning was, I thought really that was going to be about balance, and that her generation really cares about workplace balance. But again, coming at the end, that being healthy at work can mean 1,000 different things to achieved in 1,000 ways. There are a dozen of identical pieces. And so there are more factors to play into it, such as workplace culture, ergonomic, societal opinions, economic pressures, and individual behavior for being healthy at work. And I have a new appreciation. So in short terms, what that means in terms of implementation in the future with things about are things that, you know, we don't really know. And that would be something I'd be interested in, on how do some of these goals help them with their decision making in the future. So I have a lot of things that were beneficial to us. We have special topics for quick implementation. The Department of Management and our business school on campus really bought into this as something that they know is coming down the pipeline for their students to learn. My program supports faculty teaching electives in areas of expertise if possible. And the central budget model at our school allows for multidiscipline courses simply because your department is not paid by the number of credit hours taught. I put an asterisk next to this because it's not always, you know, the best thing in other ways in terms of how budgets are split, but that is one of the benefits that we see. Potential roadblocks are that course alpha codes matter. So the reason that management students have to be in a management alpha code is because there are stipulations for how many management credits that they have to take, and their college is not going to do overrides for everything or petitions. So you have to think about that when you're trying to implement it. whose territory is workplace health. So I worked a lot with who thought workplace health was their topic, not wanting to step on toes and work together. Do you have some department support from that? And right now, current program is dependent on me offering it. So if I choose not to, what does it mean from there? And finally, for future course development, this started as multidisciplinary because it does take a lot of training on the facilitator's part to teach an interdisciplinary course. So being more interdisciplinary in the future, there have been talks for a more health-specific workplace health course for the medical humanities minor. We'll have a review paper that's going to come up with some different examples of our work. And then the Team Up for Education and Health Funds is something that our college has done. And so I've teamed up with workforce development in our college that is going to really look at cataloging the resources and opportunities for workplace health education amongst our college stakeholders, and then we'll expand out from there. So in summary, what I think we need to do to get more people interested in knowledge about this is cultivate situational curiosity, start small, find campus champions, and then think big about future education models.
Thank you, Caitlin, for your presentation on the approaches that you've taken to integrating workplace health into an often overburdened university curriculum. On behalf of NIOSH, we'd like to thank all of our speakers for their presentations on such innovative approaches to leveraging partnerships to address key challenges in an expanded OSH research paradigm to support worker health, safety, and well-being. This concludes the presentation portion of today's webinar.